joins us for a conversation. Raywat, good morning.
Good morning. How are you?
I'm doing well, thank you. How are you?
I'm fine.
Glad to hear it. As we look ahead to Monday and the rather significant changes that are to come here in the province of Ontario regarding our approach to COVID-19, how are you feeling about the direction we're moving in?
Well, I'm not happy with the lifting of restrictions wholesale. I think it's a bit premature and a bit too sudden. Some things need to stay on the table and at the very least be lifted gradually, not suddenly. I think we have to remember that when we enacted the mask mandate in Ontario, there were about 115 cases per day. We have about 2,000 cases per day now, and the mask mandate's ending. So there's some strange decision-making afoot. However, we have a high vaccination rate. There is space in the hospitals, so there is good news as well.
Are you confident that given that high vaccination rate, like the modeling suggests from the science table, that we might see an increase, but it won't be as significant as increases we've seen in the past?
Yeah, I think that's fairly solid because the Omicron wave was just so extreme. However, BA2 is nipping at our heels, and so there will be a not casual wave. It might be a painful wave, but the science table is predicting that BA2 might fuel a rebound, peaking sometime in April and May, anywhere between 120 and 300 ICU capacity issues. That's a wide range, and so it's difficult to predict with any confidence what the actual necessity of action needs to be done now to prevent that potential outcome.
If not now, Raywat, when? What indicators would you like to see that would make you more comfortable with the lifting of some of these restrictions?
The big one is the masking, and the second big one, of course, is the vaccine passport system. But the masking really should stay on the table longer. The CDC has a threshold in mind. They suggest that if your test positivity rate is above a certain number, I think the number is 8%, you should keep the mask. They say if you've got 50 cases per 100,000 people in your population or more, then you should keep the mask. We're above that threshold in most parts of Ontario. So there are some objective measures to take. However, because our testing is not great and our contact tracing is not great either, we have to rely upon some other metrics like the wastewater signal and so forth. So there's a combination of things to look at. It's hard to give a solid threshold in mind, but when most things are below a certain level, I think that's when we're confident that we can open things up. For me personally, it has to do with, are the under 5s protected? Because right now they can't be vaccinated. So when there's a vaccine solution for them, probably by the summer, then we can start lifting things with more confidence.
Given, though, for the under 5s that you mentioned, Raywat, that the chances of them becoming severely ill if they contract COVID-19 are so incredibly low, why the great concern for that demographic?
Well, the hospital usage for that demographic is increasing. And given the hyper-contagiousness of Omicron and BA2, yes, the risk is very, very low for a bad outcome for these young people. On the other hand, if you get enough of them infected, then a tiny percentage of a large number ends up being a large number. And because kids aren't supposed to die, kids aren't supposed to get seriously sick, even a handful is worrying. So we want to avoid pretty much all the cases of serious childhood injury that we can. And if that means enacting a tiny inconvenience, which is mask wearing, which is a low-cost, high-impact solution, I don't see why we wouldn't.
You mentioned wastewater signaling before, and I'm glad you brought that up because that seems, at least from where I'm sitting, unless I haven't been paying enough attention, but it seems relatively new when it comes to one of the metrics that we're looking at. What is wastewater signaling telling us right now about the transmission of COVID-19?
Well, it's heterogeneous. It's inconsistent across the province. Different populations, different communities are experiencing different outcomes. It seems, in most cases, the worst of the wave is past us, for sure. In some parts of the province, there is an uptick in wastewater signaling. I think Ottawa, where I am, is one of those places. So one of the lessons is that this is not the same pandemic in every part of the country or in every part of the province. There's a lot of heterogeneity. But there seems to be an increase in some of the bigger urban centers. Not as bad as the worst of the Omicron wave, but it's increasing. And we need to remember that the bad parts of this are always lagging. So when we see the wastewater signal increase, we should be ready to respond relatively quickly before that is manifested in the hospitalization numbers.
Given that heterogeneity that you talk about, Raywat, and recognizing absolutely that the pandemic continues to impact different parts of the province, different parts of the country, the world differently than others. At the same time, we know that the virus, the disease, can impact vulnerable populations differently as well. So as we move forward, would it not make sense to offer as much protection as we can to those vulnerable populations while those who are less vulnerable live with less restriction?
I think that's unavoidable. The question is at what pace to make that transition and when to start making that transition. I think everyone's on board with starting that process now. The question is the pace of it. And we have to ask ourselves, what are the innate values that define Canadian society at the moment? How much individual sacrifice are we willing to make for the general public good? And that's an important moment in Canadian history right now. And again, I want to harp on the masking because that's, again, a low level of inconvenience that we can all undertake to keep the vulnerable more secure. Other things that we can do at the population level include things like symptom checks. Right? If you're not feeling well, if you've got symptoms of COVID, stay home, don't go to work. And if you're an employer, make that opportunity available for your employees. So we're going to be layering on a variety of more public health controls as we open society. So a new normal includes a more cognizant level of understanding and protecting each other.
Given that it's a mandate that's being lifted, a masking mandate that's being lifted on Monday, obviously the option for those who choose to still wear a mask exists. So is your concern, Raywat, that not enough people will exercise that option once the mandate is lifted?
Two concerns. One, not enough people will exercise it, and also there will be some stigma attached to those who do continue to wear masking, as we're seeing in some parts of the country already. People pointing out mask wearers and hurling abuse at them, which is bad for a number of reasons, including we should be encouraging responsible behavior, not criticizing it. So when masking is done by a certain proportion of the population, it results in significant diminishment of transmission. And if we don't hit that threshold, we don't see the same impact. And it's the kind of masking that matters also. If you're going to mask for self-protection, the respirators, the N95s, the KN95s doesn't matter. If you're masking for protection of the community, then the three-ply surgical masks have some effect. I'm hoping that more people take it on board to individually choose to wear a mask, and perhaps some places of business will enact their own personal mandates.
What does it look like to you to see this pandemic transition into or become endemic?
Yeah, that's a dangerous word. Endemic just means we essentially have no more real waves, and it's always localized to a certain geographical area. You can have a high level of endemicity where you're in crisis all the time. We don't want that. You can have a low level of endemicity like chickenpox, where it's always with us, but we have a high-powered vaccine, most people are immune, outbreaks occur, but that never makes the news. I would like to see the second scenario. That means doing what we can to suppress transmission as much as we can and hold it down with a better vaccine rollout and improved vaccination. I think that's probably an ideal scenario, and we can totally get there. We're seeing high levels of population immunity with 3 doses of vaccine and new vaccines coming down the pipeline as well.
Raywat, really appreciate your time on the show this morning. Thank you very much for joining us.
My pleasure. Thank you.